Hey guys, welcome to my YouTube channel. I'm Nurse Lalies and I'm back with another video. If you are here for the first time, please do subscribe to my channel. And if you're a returning subscriber, thank you so much for coming back. Wow, the lighting outside it's doing the things. Yeah. Thank you so much for coming back to my channel, guys. I'm so excited to be doing another video, and today I'm discussing another very important topic when it comes to pregnancy. You guys know I'm all about pregnancy, so yeah, we're continuing with another video on the pregnancy series, and today I am talking about signs of labor. So what are the signs of labor? How can you know that you are in labor if you're pregnant? When do you go to the hospital? Yeah. And when do you call your midwife or your doctor? So that's what we'll be talking about today. I'll be going in depth talking about these things, and if you do enjoy this video, please give it a thumbs up. Please subscribe to my channel. Please click on the notification bell so that you don't miss out on anything that I post. And if you know someone who is pregnant and that might benefit a lot from these videos, please do share these videos with everyone that you think might benefit from them. So without any further ado, let's get on to this video. Alright, so when it comes to the process of labor, I'm going to be talking about three things. I'll be talking about contractions, rupture of your membranes, and your discharge. So that's what I'll be focusing on in this video, because when you are in labor, your labor will affect any of these three things, if not all of them. So that's why we'll be talking about them, and these are the things that you need to pay attention to the closer you get to delivery. You need to pay attention to any contractions that you are having, which means any pain that you are having on your uterus, and you need to pay attention to any water that is coming out of your vagina, and you need to pay attention to your discharge. So let's talk about the first thing, which is your contractions. What's happening down there in your uterus. All right, so when you are in labor, you are going to start having regular rhythmic contractions, right? And it's very important that you take note of the words regular, rhythmic. They are very important, and you will get to understand why as I continue to talk about these contractions. So when you are close to being term, right, which is about around 37 weeks, some women might start to have something called Braxton Hicks contractions, right? So they might start to have something that they describe as period-like pains on their abdomen, on their uterus, right? And these might have a very irregular pattern. They may come and go. They might not be so regular. So when you are having Braxton Hicks contractions, it doesn't mean that you are in labor. The time when you'll know that you are in labor is when you're having these regular rhythmic contractions. So what does regular and rhythmic means? So let me make an example. Let's say I'm pregnant. I am 38 weeks pregnant, and today is a Sunday, right? I think it's around 1 o'clock in the afternoon. So let's say I'm 38 weeks and I'm just chilling in my house, doing my things, cooking, whatever, watching YouTube, doing whatever, right? And then I start to feel some pain in my abdomen or some contractions. But they're not so regular, you know, I just have a small contraction here and then it goes away after like 5 seconds. I continue with my life, right? It came and it went. And then, so let's say maybe 2 hours after that, I feel another pain. It lasts like 10 seconds, right? That's a very short time. It goes away. It doesn't come back. I go on about my life. But now let's say in the early evening, around 6-7 o'clock, let's say now I start to have contractions that are getting closer together now, right? Getting closer together. let's say now I'm having a contraction every let's say maybe every 30 minutes, right? So now I'm starting to actually notice that, no man, there's something happening, but not so severe. I can still go on with my life, do whatever I need to do in my house. I can still chill and relax. I mean, every 30 minutes, that's still quite relaxed. Let's say now it's 11 o'clock, I'm going to sleep, but now the contractions are super closer together. They're like every 5 minutes or every 10 minutes I'm having a contraction, right? And this contraction is lasting quite a considerable amount of time now. Perhaps it's lasting for 30 seconds. Now at this point, if I'm having a contraction or a pain in my stomach every 10 minutes, of course I'm going to know that something is happening here, right? And I also know that I'm 38 weeks, so I'm close to giving birth. What does that tell me? That I might be in labor, right? So I'm having these contractions and they are regular, meaning that they have a pattern. They have a pattern, how they are coming and going, right? They have a set pattern. They're coming every 5 or 10 minutes. I'm having a contraction every 5-10 minutes, and it's lasting a certain amount of time. So that will tell you that you are in labor. And I think that women need to have the skill of being able to time their contractions. It's a very important skill, because knowing how far your contractions are is the one that will tell you when to go to the hospital, right? So when do you actually go to the hospital? Now you realize that, oh my gosh, I'm having a contraction every 10 minutes. When do you actually go to the hospital now? Okay, so a lot of sources have said that you should go to the hospital when you are having contractions every 5 minutes that are lasting about 45 seconds long, right? And I got this particularly from this other private hospital's pregnancy care guideline, right? So this is what they tell the women who are attending at their facility, that they should go to the hospital when they're having contractions every 5 minutes that are lasting about 45 seconds long. So obviously, for you to be able to know that your contractions are lasting 5 minutes, you need to count them, right? You need to time them. You need to use a stopwatch. When you start feeling the pain, click on your stopwatch so that it can sort of like time your contraction, so that you can see how long your contraction is lasting. And then so you'll know how long it's lasting, and you will know how long it takes before you have the next contraction. So yeah, you need to be able to time your contractions, and as soon as you're having those regular rhythmic contractions, you need to go to your hospital or your clinic where you will be delivering, right? Or if you're in private healthcare, you can call your midwife or call your gynae and let them know what's happening, and they will be able to direct you further, right? Yeah, so as you're going along throughout your pregnancy though, does it mean that you can ignore any lower abdominal pain or any like contractions that you are having? No. Any pain as a pregnant woman in your stomach that you are having, you need to pay attention to. Any pain. And especially pain that's associated with bleeding. Pain in your lower abdomen that's associated with bleeding early on in your pregnancy. If you are less than 24 weeks, it can indicate that you are having a miscarriage. And then if you are more than 24 weeks, you could be having something that's called placental rupture. I've mentioned this a lot in my videos, where your placenta is detaching from your uterus and cutting the blood supply to the baby. So you'll be starting to have these contractions, and you're going to start having bleeding. But also, even if you don't have any bleeding, any pain in your abdomen, you do need to pay attention to, because if it's early on in your pregnancy, it might mean that you might be having a miscarriage and the bleeding might follow later. Or you might be in labor. You might be in labor preterm. You might be having preterm labor if you're starting to have these regular contractions, right? So whenever you're starting to have any abdominal pains, you need to pay attention to them, pay attention to their rhythm, pay attention to how long they last. Just pay attention to any pain that you are having in your abdomen. If it's pain that's constant, that doesn't give you a break in between, it could mean that you probably have an infection of your bladder, or you have an infection of your vaginal discharge. So you also need to pay attention to those things. And if you are worried about it, if you don't understand this pain that you're having, definitely the best thing to do would be to go straight to your hospital or your clinic so that you can seek medical assistance. So when it comes to pain in your abdomen, contractions, uterine pain, definitely it's something that's very important, and it can be a sign of labor. So let's go on to the second thing that I mentioned now, which is the rupturing of your membranes. So what are your membranes? Your membranes are the lining inside your uterus that is protecting your baby inside the uterus and keeping the water that's cushioning your body inside your uterus. I'm going to insert a picture up here so that you can see how the whole setting inside the uterus with the baby inside looks like, right? So these waters that are inside your uterus, they provide a cushioning for your body. They affect the temperature of inside the uterus. That is, they maintain the temperature inside of your uterus. That's best for your baby. Your baby's there bouncing around. It's a protective mechanism as well for the baby inside. So once your waters rupture or your membranes break and you're having that gush of water, we've seen this a lot in movies, whereby this pregnant woman will just be having this gush of water that's just coming out. So that could also be a sign of labor. Your membranes can rupture either before you start having contractions, or it can rupture during a contraction, or it can rupture after you've already started having contractions, right? So if your membranes rupture before you start feeling any pain in your abdomen or on your uterus, it is still a sign of labor, and you definitely need to make sure that you seek medical assistance. You go to your hospital, or you go to your clinic, or you call your midwife or doctor when this happens, right? Because those waters are a protective mechanism for your baby, and once they are out, your uterus might start having now contractions, because your body will think that you are in labor and start pushing out the baby. And this can happen early on in your labor, like you can be having a pre-labor rupture of membranes. And now the thing is, when that membrane covering that's protecting your baby is not there anymore and it's open, that can be a route for infection to go from your vagina up into your uterus and can affect the baby. So if your membranes have ruptured, you definitely need to make sure that you seek medical assistance. Whether or not you are term, whether you are preterm, you need to make sure that you seek medical assistance. So an important thing that you must do when these waters come out, you need to note the color of the waters, right? The waters can be clear, they can be green or yellow, right? And when they are green or yellow, it tells you tells you something significant about the well-being of the baby inside the uterus. We want these waters to be clear. When they start becoming yellow or green, it's indicating to us that the baby has pooped inside your stomach, right? And that's not supposed to happen before the baby actually comes out of the uterus and is born. When it happens when the baby is still inside your uterus, it might mean that the baby is in distress, or the baby for some reason is getting tired, right? And that's a medical emergency. Once you see that your waters have ruptured and they are green or yellow, definitely you need to make sure that you go straight to the hospital or to your clinic. In fact, when you see your waters rupturing, immediately you need to make sure that you seek medical assistance. So don't stay at home and wait till maybe you start having contractions. Whether you have your waters rupturing before you have contractions or not, you need to make sure that you go to the hospital. All right, so and then the third thing that I said I would mention is your discharge. So sometime before you get into labor, or when you are in labor, maybe early on in your contractions, or when you start having contractions that are regular and rhythmic, you will start having a discharge, a sticky discharge that's mixed with blood. Now that sticky discharge that's mixed with blood, we call it shock, right? So once you start having that discharge, it can indicate to you that you are close to getting into labor. Or it can also happen, you can start noticing it when you are actually having contractions. That's more assurance that you are actually in labor. So those are the three things that you need to pay attention to throughout your pregnancy. And then something that's very key that I want to mention about the contractions is that, or actually with all of these signs of labor, something that's very key that I want to mention is that, number one, you don't want to wait too long in order to go to the hospital or to your clinic where you'll be delivering. You don't want to waste time and go there when it is already too late and your contractions are already so painful that you already feel like pushing the baby out, right? And then at the same time, you also don't want to go to the hospital too early on. You want to stay at home for as long as possible in a comfortable environment, in your comfort zone where you can be comfortable, because honestly, if you're going to be delivering at a hospital, hospitals are not the most comfortable places to be in, right? But when you are still at your house, you can relax, you can take a warm bath, you can be in your own bedding. It's just a more relaxed environment for you. You also feel calm, there's less anxiety compared to when you are in that unfamiliar environment that is a hospital, right? So when your contractions are still far apart, you don't need to go to the hospital. And if you are in private health care and you're fortunate enough to be able to contact your midwife or your doctor. So that's very nice, because then you can be able to call your doctor or your midwife and they can be able to direct you and tell you when to come to the hospital. So if you do have that privilege, make use of it. But it is very much important to not go too late to the hospital, and also not to go too late, that you end up now delivering your baby while on the way to the hospital, maybe in a car or in a taxi or cab or whatever. So yeah, and also there's some admin things that need to be done at the hospital when you get there. So you do need to get there before the pains are too strong to the point that you cannot even think. Yeah, so it's very important, very, very important. So you need to think about, are you having any pain in your abdomen? Are you having this show discharge? Or are you having any waters that are coming out of your vagina? And then another thing that I want to quickly mention that you need to observe during this time when you are in labor and you're having these signs, observe your fetal movements. Observe how your baby is moving. Is your baby kicking and moving as normal like before? If there are any changes in the movements of your baby, whether or not your baby has reduced fetal movements and you can't feel the baby move as much anymore, try eating, try drinking something. Make sure that you are keeping yourself hydrated throughout the time. Make sure that you are not starving yourself. Keep yourself mobile for as long as possible when you are in labor. So if you start having these contractions and you are still at home, monitor your fetal movements. Try and stay upright and be mobile, walking around as much as you can, so that you can help the labor process. Even the gravity, if you're staying upright, will pull the baby down, and that will help with your labor. So yeah, make sure that you're observing your fetal movements. Make sure that you are eating, because when you now get to the point where you actually have to deliver your baby, you need to have all the energy that you need. So yeah, that's what I wanted to mention about how to prepare yourself just a little on how to prepare yourself for labor. Actually, I think in the coming weeks I want to do a video where I'm going to talk about how you can prepare yourself for labor physically, emotionally, and mentally. What can you do in order to prepare yourself for labor? So yeah, that's all I wanted to share in today's video, and I hope you really enjoyed it and learned something from it. If you enjoyed this video, please do give it a thumbs up. Please subscribe to my channel and click on the notification bell. Also, please do comment, leave your comments in the comment section. If you like this video, whatever you want to add, what helped you maybe in your previous pregnancies, anything. I love engaging, so please do leave a comment in the comment section. Thank you so much for watching this video till the end, and can't wait to be here again and record another video for you guys. But for now, see you next time. Bye.